Oxygen cylinders are metal tanks that store compressed oxygen. These cylinders come in different sizes depending on the amount of oxygen they hold. Oxygen tanks are for the patient's use at home and on the go. Your healthcare provider will write you a prescription for home oxygen, the amount of oxygen you will need to meet your body's needs when you are both at rest or up and around, and the most appropriate device for oxygen delivery. Your oxygen concentrator is for use within the home. Patients use oxygen tanks for mobility, travel away from home, and as emergency backup. Oxygen concentrators take in air from the room and filter out nitrogen. This provides the patient with a higher amounts of oxygen needed for oxygen therapy. Concentrators use electricity to run. Should the power go out, it is important that you have a backup oxygen tank available to use during power outages or equipment failure. An oxygen regulator displays how much oxygen remains in the tank. Green indicates the tank is full. Red indicates the tank is empty. Keep in mind, the liter flow determines how quickly a tank will empty. Check the tank gauge often so you know when the tank is close to running out of oxygen. The control lets you adjust the flow of oxygen to the prescribed liters per minute. The oxygen outlet is where you connect the oxygen tubing and the nasal cannula. With a standard flow regulator, you will feel the oxygen flow continuously. Some patients may use an oxygen conserver device. The conserver device delivers oxygen in small bursts when you inhale. These devices, as well as portable oxygen concentrators, require a titration prescription from your doctor. Also remember, the faster you breathe, the shorter your oxygen tank duration will be. If you find your work of breathing increased, the oxygen conserving device may not be appropriate to meet your body's oxygen demand. Work of breathing is the energy you use to inhale and exhale the oxygen. Any change in the airway can increase your work of breathing. If you have an increased work of breathing, you may need a new oxygen assessment to evaluate any changes in your oxygen demand and needs. Setting up your oxygen tank or changing the regulator. To set up your e-tank portable unit, place an oxygen tank securely on the provided cart and secure the tank onto the cart with the provided bolt. After placing your oxygen tank on the cart, ensure you have your regulator available. Before placing your regulator on your oxygen tank, make sure the O-ring washer is in place. The regulator only goes in one way, with 4 pins that secure the regulator into place. Place 2 pins here and 2 pins here. Place the regulator on top of the tank and slide it into position. Secure the regulator by tightening the T-handle. Notice slight indentations on the post valve of the tank. Line the pins up with these indentations. Set your liter flow with the dial. Open the tank. Check the tank's contents gauge to make sure it reads green, indicating that the tank is full. Today, we will show you an example of a patient receiving 2 LPM. After setting the deliverable amount of oxygen, turn the neck valve counterclockwise, 1/4 of a turn to turn the tank on. Place your finger over the hole to listen for any air escaping. If you hear a hissing sound as your finger covers the hole, check the regulator to make sure a washer is in place. If you do not hear any sound, keep your finger on the hole and turn the tank off by turning the neck valve 1/4 turn clockwise. Do not over-tighten the neck valve. Air in the regulator will continue to drain out over a few seconds. Once this occurs, you may attach tubing to the regulator port. The regulator port may be on the side or at the end of the regulator. Tank duration. Safety issues. Do not use oil or petroleum-based lubricants on the regulator, the post valve assembly, or around your face and nose. Always secure the cylinder when traveling. Lay it on its side so it cannot roll around. Secure with blanket or seatbelt. Keep oxygen cylinders stored in a well-ventilated area. Do not store in closet or trunk of a car. This can create a fire hazard. If you cannot secure the cylinder in an upright position, lay the cylinder on its side and secure it. Keep oxygen at least 6 to 8 feet away from any heat source. Keep away from any flammable material, such as grease, oil, aerosol, paint, gasoline, or solvents. Avoid friction gadgets that can cause a spark around oxygen. Oxygen is not flammable. However, it makes things burn hotter and faster. Do not smoke in the same room as your oxygen equipment. Bleed the pressure from the tank when the tank is not in use. Do this by turning off the tank and leaving the regulator flow on. Do not use oxygen mask with a humidifier on the oxygen cylinder. This may cause severe back pressure within the tank. Call your home oxygen company to replace the oxygen cannula once every 2 weeks. Replace oxygen cylinders, the washers on the regulator if you detect a leak. Only use recommended washers. Call the Home Medical Equipment Company number listed on the sticker located on your device.